You need to know what your rights are. You need to know when to appeal a prior authorization or a denial of care or a wrong bill. That's critically important. And I cover that in the book as well, because you do have rights as a patient. And if you do fight these things, a wrong bill or prior denial of payment by your insurance, most people win them.
Welcome to Mama Mable's Caregivers podcast, where we empower caregivers with the knowledge, support, and conversations that help you care for your loved ones with confidence and compassion. Today's episode is titled The Healthcare System Explained: What Every Caregiver Needs to Know. If you've ever left a doctor's appointment with more questions than answers, struggled with a denied insurance claim, or felt overwhelmed trying to advocate for someone you love, you're not alone. Joining us today is Dr. Terry Adirim, a board-certified pediatric emergency physician and physician executive with more than 25 years of experience spanning academic medicine, federal health leadership, and health policy, with a sharp focus on AI in healthcare and what the changes in our healthcare system actually mean for patients. She's the author of The Prepared Patient: Your Guide to Surviving the Healthcare System, due for release by Johns Hopkins University in August of 2026. She is currently a chief medical officer and advisor to healthcare startup companies, an author and an expert consultant on health system transformation. Previously, she served as the acting assistant secretary of defense for health and affairs at the Department of Defense, DoD, and previously served as the DoD military health system chief medical officer. She's written more than 100 peer-reviewed papers and given 100 national keynotes. Her mission is to empower patients with information on how to navigate our fragmented and opaque healthcare system by providing plain, practical advice that can be used when encountering an inaccurate hospital bill or a denied claim. Let's get into it. Welcome, Dr. Terry Adirim. How are you?
I'm good. Thank you for having me.
Thank you so much for agreeing to come on to Mama Mable's Caregivers podcast and share all of the knowledge that you have obtained with our guests today. With the podcast family today. Podcast family, this is going to be a dynamic episode. You know how I do and what I usually say. And the reason why is because Dr. Terry Adirim has so much information that she's going to share with us, some great information. So I'm just going to get straight into it. You know how I do. The title of today's episode is The Healthcare System Explained: What Every Caregiver Needs to Know. So with that said, please, Terry, tell me about yourself.
Yes. Thank you, Talisa. And thank you for inviting me to be on this podcast. It's a really critical service, I believe. I think most of us are going to one day be a caregiver if we're not already. Kudos to you for doing this public service for people. As you said, my name is Terry Adirim. I have a 360 view of the healthcare system. I've been a physician for over 25 years. I have been a health policy maker, an expert, and a physician executive. I worked for the federal government. I led the military health system, which is like any other health system with hospitals, clinics, and a health plan. So worked a lot with families as well as military service members. And I've also worked at the Department of Veterans Affairs, deploying their new electronic health record, leading that effort. So I have a pretty interesting view, round view of our healthcare system. So I know full well from all of those angles how broken it is. And a few years ago, I realized that not one person, not even a small group of people, are going to change what is broken, how we're going to fix it. So I really wanted to make sure that people had the information that they need to help themselves. And I know that's really a shame that people have to do a lot of that work, especially if you're a caregiver and you're already doing that important work of taking care of your family member or whoever you're taking care of. But with this broken health, opaque and non-transparent and difficult healthcare system, I think it's really important to learn more about it. And what inspired me too was reading the statistic that only 12% of people are fully health literate. And that has big impacts for our health outcomes and our finances. And the people who really inspired me to write this book were the families that took care of early in my career. And I say this in the book. I have an introduction where I talk about the families of children with special health care needs. I practiced pediatric emergency medicine for over 25 years, and I worked in places where we saw a good number of children with medical complexity who saw multiple practitioners on multiple medications with multiple conditions. And what impressed me about their families is that they were really prepared. They would come to the emergency department with their white binders, and they're always white, and they would have all the information we would need. And you can imagine not knowing the child, having that information handy with family members who knew fully what their child needed was super helpful. It made delivering care quicker and easier and better for these families. So those people were my inspiration. But caregivers, run the gamut, to spouses taking care of family members. And I saw that a lot at the Department of Veterans Affairs, taking care of our war fighters, family members, those who are injured, all the way to people just like you, Talisa, who have taken care of their parents. And I think a lot of us are going to be in that situation if we're not already. So that's what my inspiration and why I wrote my book.
Wow, that's beautiful. Being on the front lines and taking care of patients and understanding that there's a need and doing the research and finding out how many people are actually prepared and then deciding to create resources for the caregiver to help them is beautiful. Because to your point, I'm sure I speak for many caregivers, a lot of times we're thrown into it. Mm-hmm. Whether you are a parent of a neurodivergent child or you're an adult that one day you take your parent to the doctor and they're diagnosed with a terminal illness, it's like, okay, boom, now you're here. You're in the present. What do you do? What's the next step? How do you really go about advocating? What are the things to look out for? There's so many questions. And at the same time, you find yourself doing your best to take care of your loved one. And also because generally speaking, caregivers, we wear many hats. It doesn't take away from the fact that you still have to work. You may be in a leadership position on your job. You still have all of these other responsibilities. And it comes to a point where you say, well, how do I find out what I need to know and make sure that I stay afloat? And you created resources for that. So please tell me more. Thank you so much. And tell me more about what you have created.
Yes, no, I would love to. First, the name of the book is The Prepared Patient, Your Guide to Surviving the Healthcare System. And it really is about surviving the healthcare system. And you make so many excellent points. I don't even know where to begin, but I'll start with taking a step back. And I think the best thing that we can do for our loved ones is that each one of us be prepared for what I will call the inevitable, right? All of us are going to encounter the healthcare system at some point. And especially as we get older, you know that there's going to be a time where, God forbid, you have an accident, God forbid, you have an illness or a chronic condition or something even more serious. So being prepared up front, I think, is very helpful. And my book dives into knowing how to be prepared, having all of your information in one place, understanding your information, like your healthcare coverage, right? Most of us do have healthcare coverage. Some of us actually have a choice. So how do you make those decisions about healthcare coverage? Doing that kind of preparation helps your loved ones should they need to become caregivers. So an example, and I talk about this in my book too, my parents, when they were still fairly young, like probably in their 50s and 60s, created their documents that they needed that said what they wanted at the end of their life. That is so critical so that families not confronted with having to make these decisions. These decisions are made ahead of time. So it's not just about a will, but it's also about who you want to be your medical proxy. If you can't make a decision, who can make that decision for you? Do that ahead of time when you're well, right? So that you don't have to think about it or struggle suddenly when something does happen. So I try and take people through that whole piece of it, starting from early childhood about what to expect in the healthcare system and what your needs may be, to young adulthood, to middle age, to I spend a lot of time talking about healthcare coverage, Medicare, and how to make those decisions and living wills and things like that. So I think it's upfront being prepared beforehand so that when the time does come, your loved ones know what you want and they know how to handle it. Now, as we get older, and somebody told me this week that when their parents started to become more frail, they started to insist on wanting to go to their medical appointments. And I think that's a really excellent idea, right? Having those tough conversations with a parent. Nobody wants to ever be called frail. Nobody wants to get old. Nobody wants all those things to happen, but they do. And I think having an advocate before you really need that advocate would be so helpful to both you and your caregiver. And I, even at younger ages, my daughter's a young adult, right? I've offered to her when she goes to her doctor appointments, of course she says no, but I offered to, do you want me to come with you just to be the extra set of ears? That's actually also a good idea too for anybody across the ages, but becomes even more important when you may be that person who has to be the caregiver.
Very well said. That's actually something that I spoke on in a few episodes now with different guests, because that is just great wisdom. When you are the patient and you're going in to see the doctor, your mind might not be where it needs to be to ask all of the questions that you need to ask while you have the doctor in the room with you. However, if you take someone with you that cares about you,
Right.
they can ask questions that you might not have thought about. And if you tell your loved one prior and ask them to look into it, just do some research on their own and have some questions, that helps them to be prepared. And have, like, again, from my experience as a caregiver, I was in my early 30s. And even until my mother was at the point where she was about to pass away, she said, it's just so hard for me to look at you as an adult. She says, yes, you're an adult. Yes, I've done all of these great things. So you're clearly an adult, Talisa. She said, but every time I look at you, all I see is my little girl with the long ponytails. So it can be hard. It can be very challenging.
Yes.
As the adult child now, to have those conversations with your parent or a loved one that's older that you are now taking care of, because they still may see you, although you are an adult, although you do have children, etc., they may still view you as their child. However, even so, these are conversations that you need to have, and you'll need to stand 10 toes down and really hold your space and say, hey, listen, this is the situation, this is the role I'm going to play, and this is how I plan to help you.
Yeah, that's exactly right. And those are clearly words of wisdom from somebody who has been down that road. And I think that's really important to tell your story because people could really learn from that. And I think, too, as part of that is saying, you may not see me as an adult, but I'm here to help you. I care about you. You're the most important, you're amongst the most important people to me. And I want to make sure that everything goes the way that you want it to go. I will say you brought up another really good point about having an advocate with you at your appointments. For those that don't necessarily want somebody at their appointments, but for those type of appointments where you may get bad news, yes, you definitely should. But there's ways that you can prepare for your visit beforehand, right? thinking about your doctor's only going to have a certain amount of time. What are the most important things to me? What are my issues, my problems? And think about those questions beforehand and write them down and bring them with you. People don't necessarily do that, to your point. And I think even preparing for a routine appointment is very helpful, because it always happens. You leave and you're like, oh, why didn't I ask this? Why didn't I ask that? And I think that's the same lesson for caregivers that go to appointments with their loved one, is to prepare for that appointment beforehand. Write down the questions that you may want to ask about their medications, about their conditions. And I also tell people, don't be afraid to ask for clarification, right? I've had family members tell me, oh my God, I'm not entirely sure where I'm supposed to go to get this test, what I'm supposed to do. And then I'll say, why didn't you ask? Oh, I didn't think to ask. Because the physician could be rushed. They may give you shorthand answers, tell you, oh yeah, you need to go get an ultrasound, and hand you the prescription. And you're like, okay, where am I supposed to get this? So I think also being empowered to ask for clarification is really important. And that's especially true for caregivers, because you may not, at least initially, have that relationship with that physician, because the relationship is with the person you're caring for. So it's very important to ask for those clarifications. You don't look stupid, you look caring, you're not challenging the doctor. And those are some of the things that I also cover in the book as well.
Thank you for bringing that up, because again, that's something that I resonate, and I'm sure that the podcast family also resonates with. I remember there were times when my mother, for an example, was in the hospital, and I would research things on my own. This is before her cancer diagnosis, because my mother had issues with blood clots. She was constantly having issues with blood clots getting into her lungs. So that ended up being a sign for breast cancer. They did some research and tests later on, and that's how they found it. But prior to that, when that would happen, I would do research on my own, and then I would either call the doctor or fly into town if needed and go to the hospital, just so I could have conversations with the doctor. And something that I noticed from my experience is, when I actually took out the time to write out my questions that I had and do my own research, the doctor spent more time with me. Mm-hmm. And the doctors, and I know they're busy. My primary, for an example, I asked him one day when I went to see him, I said, there are a lot of patients out there. It's a lot of doctors, so for where I'm at, where I go to. And I said, how many patients on average do you see a day? And he told me around 30, 36. So they're constantly in and out, taking notes. So yes, it could seem like they are a bit rushed, but if you take out the time to do the research, ask the questions, speak with authority, because this is your time, and ask and truly just spend time with the doctor, they will spend time with you and they will answer your questions, because they did it for me.
Yeah, no, you're exactly right. And I know myself as a physician, now I'll put my physician hat on, I appreciate that. Right? Because number one, it's a big time saver. Number two, I don't have to guess what's important to somebody, right? And I like when people come armed with information. There is a way that you do that, because now people can do research using general LLMs or AI, right? And so they'll come armed with information, and using that information to start the discussion, I think, is a good thing, not necessarily to challenge things, because AI doesn't have the context. They don't know you. They don't know the situation, really. You're just asking questions. But I do think most physicians appreciate the conversation starter and knowing what your thoughts are and what your thinking is. I think that really helps. I never minded it. I started practice in the day when people were Googling things. And then there were a lot of complaints from physicians about Dr. Google, and you think, I always appreciated it. I never, not that I didn't mind it, I actually appreciated it, because it really, I thought, was very helpful.
It's funny you say that, because I think about right now we're in the space of AI and all of that. But prior to that, a lot of people really leaned on Google. I really leaned on Google. Yeah. And I used to say that I had a Google MD. You said something that was key. Use it to help start the conversation.
Yes.
However, don't use it to challenge, because as the doctor, you studied this. You're aware and you know that patient and what's going on with that patient's body more so than a general question to AI, a general question to Google would. And so if you want to have a productive conversation, I really want to make sure that, I'm clear on this when I say use it, as Terry has said, to start the conversation, but not to challenge, because you have to understand, again, like these doctors, they have so many patients and so many things they have to get through during the day, and they're trying their best to be there for you, but they don't have time to confrontations and going back and forth, especially when they're just here to help.
And if you ask, well, Claude or ChatGPT or whatever thing you're using said that it could be X. Everybody always thinks they have cancer, and when it's not. That's like probably the biggest fear, right? And they'll say, prove to me that it's not this. I think that's a conversation starter. Well, let me explain to you why it's not that. Whatever's going on with you is much more common that it's these other things, right? You don't have a risk factor for that, so it's less likely to be that. So I think, you can really have a very equal footing there, good partnership by having that discussion. You made me think about the times I was in the emergency department. Specifically, we get a family bringing in a child like with a rash, and I'm like, and rashes can be very non-specific. You can't, some rashes you could look at and you say, yes, that's definitely chickenpox, or that's ringworm or whatever. But sometimes it's not. It's kind of this rash. And I'll say, come with me. Let's go to the computer and look at some pictures. And with the family would say, what do you think? Is this what your child looks like? Is this what it is? Right. So I think you can use technology to help, with that partnership in either coming to a diagnosis, trying to come up with a plan of action. I think technology is going to help level that playing field and really help patients and caregivers going forward.
Yes, I agree. So the next step, after taking a step back as it pertains to what you've written in your book, and the name of your book, by the way.
Oh, The Prepared Patient, Your Guide to Surviving the Healthcare System.
Yes, The Prepared Patient. Okay, so the next step, after you take a step back and you look through the different types of insurance, what's the next step?
I think there's a lot that goes into understanding insurance in general, what your health coverage is, and understanding what your options are. More than half, and I think this is an important point because it's probably the biggest chapter in the book because it is complex. Most people don't know a deductible from a coinsurance. And it doesn't matter how smart you are or educated. A lot of people don't. My daughter had to ask me a question about her insurance card that seemed simple to me, but it was, that could be confusing what that is. So that's why I have a picture of it and I identify all the different pieces. But they're knowing and understanding what your health insurance and your health plan covers is really important, right? And people, especially now, have to make decisions about how they want their coverage to be. So let me explain. More than half of people in this country, about 52% of people, have employer provided coverage. So, and a lot of those people don't have a choice. Your employer says, here, you have X brand insurance and here's your coverage. So you want to understand it, but you don't have a choice. Other people do have a choice. And how do you compare, right? What are the factors that you need to look at into comparing? And if you don't get healthcare coverage with your employer, you then have decisions to make. Do you go on the Affordable Care Act marketplaces and choose an insurance? How do you choose? There's multiple different plans. There's platinum plans, gold plans, bronze plans. There's all different levels of plans. And then there's high deductible plans. What does that mean? People may not understand the impacts for what is covered and their pocketbooks. So for example, high deductible plans means that you have to pay a lot more out of pocket before your insurance starts paying for it. Are you saving money to make sure that you're not hit with a $10,000 bill that your insurance won't pay for, but that's part of your deductible, right? Versus what people are used to is a more traditional kind of health insurance where they may have to pay $30 for the visit because it's your copay. That's something different than a deductible. And then it's 100% paid for when you hit a certain amount. And it used to be about $2,000-$3,000. You'd hit that and then your insurance pays for everything. That's not necessarily true anymore because healthcare has gotten so expensive that we pay for the healthcare, for the insurance, you pay a premium. You then have to pay a copay for your visits. And it's more expensive if your providers, your doctor and the healthcare institutions are not in network as part of your plan. If they're out of network, you pay a lot more out of pocket. And I'm just using that as an example for how complex even your healthcare coverage is. So it's critically important to understand that. And the reason why it's important now is because a lot of people, because of how much premiums have gone up and how expensive it is, a lot of people are choosing not to go with healthcare coverage, which is a big risk, right? So that's the first thing, is being able to know enough to make a choice. If you have a choice, understanding your plans, and then how to make decisions about choosing your care. So it's complex, and that's why it's the biggest chapter in my book, because I really want people to understand what you can expect and what you can't expect. And there's a healthcare that's outside of what your plan will cover, right? And you may have to pay for some things out of pocket, and it can get very expensive.
Thank you for that. So within the first chapter, you did a deep dive into various insurance plans and what to really look for, what to really look at. You discussed the risk with going one way versus the other. Podcast family, this book is dynamic. I will say that this is a must-have because we all need it. Like everybody, I feel like everybody needs this book because at some point in time, either you may be the one who may be at the doctor's office and may need an advocate and may be looking at the type of insurance you have and coming up with the game plan, or you may be that person that will be the advocate for a loved one or a caregiver for the loved one, having to take that seat as well. So the next part of your book, after we get through the insurance, what's the next step that you would like to highlight?
I do talk about preparing for your visits, how to find a primary care doctor. It's really tough. I talk about this a lot with my physician associates. It's really tough now to find primary care. It is. I struggled to find primary care. And so I want people to understand the difference between a board certified physician versus a nurse practitioner versus a physician assistant or associate. So understanding who's providing that care, right? I talk about how you prepare for your first visit, what kind of information you should know and bring to your visit. I go through things like what type of care can you expect during the various stages of your life. So there's childhood. What are your vaccinations that you might expect for your children, all the way through adults? Adults get vaccinated too, but also what type of prevention tests that you need to have and at what age and where you can find this information that's trusted information, because there's a little bit of challenge these days about where to get that information. And then talking about how you access care. So what's considered an emergency, what's considered urgent, when you need to go to the emergency room versus calling your primary care physician, how to find a subspecialist, all the way to knowing your rights as a patient, right? So caregivers need to know this too. Like, how do you fight a bill that's wrong, right? Should you fight it? Yes, you should. Most people don't. Most people, if they get a surprise bill, like I explain what that is, or if they get a bill that doesn't appear accurate, I go through the steps that you need to go through. And it's time consuming. And one of my colleagues got sick, unfortunately, and and this is just an example, she had emergency care. She ended up having surgery. She ended up in the ICU. She ended up in inpatient. And then she came home and she had bills like stacked up, right? And she's a physician, so she knows the system, but because her insurance hadn't done what they were supposed to do with the healthcare providers. She ended up getting billed by her providers and ignoring the bills because the insurance was supposed to cover it. It ended up going to collections. And I'm like, oh, no, let me tell you what. And even a physician, I walked through the steps with her about what she needed to do. You don't want these to go to collections, right? And so you really need to, and especially as a caregiver, because the person you're caring for may not be able to do these things, you need to know what your rights are. You need to know when to appeal a prior authorization or a denial of care or a wrong bill. That's critically important. And I cover that in the book as well, because you do have rights as a patient. And if you do fight these things, a wrong bill or prior denial of payment by your insurance, most people win them. Most people don't appeal, but when you do, you end up prevailing. So it's critically important you do that. And I feel really bad telling people they have to do all of this work on their behalf, but that's our healthcare system. It's really a frustrating, friction-filled system for patients and physicians. It's a mess.
I'm over here so happy because podcast family, since when does a physician write this type of information to help others? I've never heard of such a thing, really. Terry is not gatekeeping any of this information, and she has used her direct experience to identify some of the key things that will help you as a patient, that will help you advocate, to help you as a caregiver. I've never heard of such a book before that has been written by a physician. Podcast family, open, honest, real talk. I will be purchasing this book for myself and also to help loved ones that come across my path and my journey, because this is really good information. This is information that we all need. And to your point, being able to just fight the bills, because we all know how it happens. That's happened to me, where I had major surgery and I'm thinking I'm fine because my insurance is supposed to take care of everything. So I didn't even look at the envelopes, the bills that was coming to me. I didn't even open it.
You have to.
I was right. I learned that I had to. And then I had to start calling.
And what's frustrating is you either have to write a letter or make a phone call. There's like no other way to do it, right? Let me give you a little anecdote. So a few months ago, I decided I wanted a CT cardiac calcium score. Okay. This tells you whether or not you have calcifications in your coronary arteries. And because I want to be healthy, I want to make sure, I'm okay and don't need statins or anything. Insurance doesn't pay for it. So I called the radiology place and said, I would like to, have this test. I asked my doctor to send in a prescription. And they said, oh, well, insurance doesn't cover this. You're going to have to pay for it out of pocket. I said, yes, I understand that. And they said, that'll be $250. Payable when you get to the radiology place. I said, okay, I'll pay $250. That's how much it is, right? They're like, exactly, it's $250. So I go, put out my credit card, pay for it. Last week, I get a text and an email from the radiology center saying I owe $385. I'm like, what? So I had to call twice. All right. What a pain in the neck, right? You're a busy person and you have to call them and sit on the phone for an hour. So the second time, I got through to somebody at a call center and she said, oh yeah, you owe $385. The insurance doesn't cover it. I said, yes, I know. I paid out of pocket. I paid for it when I got there. I was told ahead of time how much it was. And they said, oh yeah, I see you made a $250 payment. You owe $135. I said, no, I don't. Now this is a small amount of money. Somebody would say, oh, just pay it. I said, no way. I said, I'm not paying. I'm not paying for it. I'm appealing this and I'm not paying for it. I prevailed, right? Because it was their mistake. And this happens all the time, right? And you need to fight it because it's just not fair to you as a patient or a caregiver that these mistakes are made.
Thank you for sharing that. And that's very true. Podcast family, I have seen just TikTok videos on how to fight when it comes to bills and questions, but never this much detail on how to really go about it. And to your point, If you are being charged something that is incorrect, you have the right to fight it. And as the patient that has gone through various, you're already not feeling
Right.
well, you're already
Right.
having to wrap your mind around all of this. And then you encounter this part of your journey where you're being charged for things that you should not have been charged for. I know a lot of times it's just easier to just, okay, whatever, just pay it. But you don't have to take that route. And with Terry's book that she has written, she provides you with access to understanding how to go about fighting it.
And just simply
Mhm.
using your example, you said you had surgery, right? So that includes testing, that includes maybe imaging, that includes inpatient visit, doctor's visit. So there's multiple pieces of it. So what do you get when you get a bill? More often than not, you just get the total amount you have to pay. So the first step is asking for an itemized bill because you want to see where all the charges are. And there could be duplicate charges. There could be outrageous charges like $100 for that one Tylenol you asked for. There could be a lot of things about that bill that are just inaccurate, right? You also want to know if you had surgery, if it said the hospital you went to and where you were cared for and your doctor are all in network. But what if it says the anesthesiologist wasn't in network? They were out of network, so you have to pay more. You have rights in that regard. It's called the No Surprise Act. They can't do that. They have to charge you. You only have to pay the inpatient amount. And then it's up between the hospital and that anesthesiologist. That's not your problem. You just have to say, nope, can't have, that's a surprise bill. So the first step is itemization and then doing internal appeals. There's appealing with your insurance company, and then you can escalate it all the way up to your state attorney general or however it works within your state. But don't let these mistakes or don't let these institutions take advantage of you, and you really want to avoid having them report you for collections, because once that happens, unfortunately, the current administration reversed the policy where the last administration said that it doesn't go on your credit report. Now it could go on your credit report. So you need to be really diligent. And I hate to say that because it's so unfair and wrong that this is a problem, but caregivers really need to be organized, keep all the bills, ask for itemized bills, write down who you spoke to. If they have a reference number, write that down too. Get serious about knowing your rights and exercising your rights.
Again, thank you for that. I had no idea that law was reversed. So that's something
Yeah.
even new for me because, to your point, I was with the Biden administration, they stated like, oh, it won't show up on
Medical debt
with
would,
the medical part. But now it's been reversed.
I think so. I'm pretty sure. I
Yeah,
have to look that up, but yeah.
I wouldn't look. I wouldn't be surprised.
Yeah, it's not right now. The situation is that it's not as consumer friendly, and there's a lot of transition on how these things work. So, and it's really hard to keep yourself updated. I know even writing this book, before, I had to turn in the final copy, I was sitting there rewriting sections because there were, a new administration came in and they were already making changes. And the one big, beautiful bill came out. So I had to include that in there. And what are the impacts for people, for example, who are on Medicaid? That's another story for another podcast. But, that all the pullbacks on some of these things really will have impacts on patients and their caregivers.
Thank you. Thank you for, again, just sharing all of this information. Is there anything else that you would like to highlight from your book for the podcast family?
Yeah, sure. First of all, thank you so much for the work that you're doing. It is so important. I think caregivers are probably my favorite audience because they're doing such hard work and they're doing free work that is done out of love. So they're my favorite people. I loved the families of children with special health care needs. It was definitely a inspiration and a bond there. So my book is The Prepared Patient, Your Guide to Surviving the Healthcare System. It's being released by Johns Hopkins University Press on August 11th. Right now, it's available for pre-order from that website or Amazon. And I encourage you to get it. I'm not going to get rich. I'm not making money from this. But for me, it really was a labor of love. And it really was something I wanted to do because I've been inspired by my patients over the last over 25 years. So thank you so much for this opportunity, Talisa.
Thank you, podcast family. This is such a jewel to have Dr. Terry on here to provide this information for the podcast family.
I like writing. I do a lot of writing. So that, it was good. It was a labor of love.
Yes, exactly. And podcast family, that's exactly what it is. And for her to go into depth with the information that she is providing everyone, like I said, I will be pre-ordering this book. You know how I do it, podcast family, as it pertains to the description of this episode. Everything that Dr. Terry has mentioned will be listed, including where to purchase her book, including the links where you can order her book from both John Hopkins as well as Amazon. And I encourage everyone to please purchase this book because it will help you. At some point in time, I'm sure that it will help you.
Thank you. And keep up your advocacy. Amazing work, amazing podcast. Thank you.
Thank you. And Terry, thank you so much again for agreeing to come on to Mama Mabel's Caregivers podcast. I sincerely appreciate it. I know that the podcast family will also sincerely appreciate this episode. Podcast family, until next time.